Hi, I'm Dr. Steve Lininger. Today I'm going to talk to you about a disc bulge and what causes it. So disc bulges are commonly diagnosed on MRI. When you get the MRI though, it tells you where the disc bulge is and which direction it's bulging and if it's encroaching on the nerve, things like that. What no one ever talks to you about is how you get a disc bulge in the first place. So a disc bulge is typically caused by distortion in the posture of the patient, plus the forces of gravity pushing down, squeezing and bending the spine ever so slightly over time. And when that happens, what happens is the spine actually bends and puts pressure on one side of the disc and causes it to bulge out the other side. So a disc bulge looks like this. So this is a normal disc, and on the MRI, the disc will line up with the back of the vertebrae and the front of the vertebrae. On a disc bulge, or later they're known as herniations, when they bulge out, there's a squeeze here, and that squeeze is from compression of the force of gravity, and then there's from the postural distortion bends the spine and causes the direction of the disc bulge. So whether it goes posterior or back to the left, or posterior right, back to the right, or sometimes they go anterior. They go anterior, you're not even going to know you have one, because it doesn't hit any nerve in the front, and there's nothing that lets you know you even have a disc bulge because they're asymptomatic in most cases. In fact, all disc bulges most of them are asymptomatic. 1/4 of the population have a disc bulge in their spine right now and don't even know they have it because they're not hitting a nerve that causes pain. Okay, so but if you were to take MRIs of the general population, that's what you'd find. You'd find that 1 in 4 people have a disc bulge. Most of them don't even know they have it because it doesn't cause any symptoms. And most of those are self-resolving over time. So what will happen is when you get a disc bulge, the ones you know about are the ones that are hitting a nerve, and not just any nerve. It has to be a pain nerve, because the other nerves don't. 90% of the nerves in your body don't feel pain. Only the nerves that go to the exoskeleton have a lot of pain fibers, which the exoskeleton is the outside. Like my hand has a ton of pain fibers. My foot has a ton of pain fibers. And that's because those are the extremities, and when I touch a hot stove, my brain needs to know to remove my hand. So anyway, I don't have a lot of pain fibers on the inside of my body. They're on the outside. So the disc bulge, when it bulges out, it hits the nerve. The nerve either goes, if it goes down my arm, it's going to cause radiating pain, numbness, or tingling down my arm, into my hands. If it goes down my leg, it's going to cause those symptoms in my leg, one or both legs, depending on which way the disc bulges. So if it bulges straight back, let me see here. You can see this better on the top. If the disc bulges straight back, it hits both nerves, and I get bilateral symptoms. If it bulges one side, then I only get symptoms on one side. Okay. Sometimes a disc bulge will move. It'll start out on the right, then because of the way the patient moves, it can shift around. So the symptoms can vary, but the cause is always the bulge. I'm Dr. Lininger, and that's disc bulges. Have a nice day.